Hey guys, it's me again, Vincent. So we're back at it again with another, video entry in terms of our explaining the findings of the Youth’12. So this time around, we'll be talking about health and access to healthcare in relation to youths. Yep. So we're gonna be talking about general health, access to healthcare, even dental care, and then we'll talk about some of the healthcare services that were kind of visited by youths the past 12 months. This is obviously, again, we say from the 2012 survey. It may have differed. It may differ from now, the things that are happening now, but this is if you have any interest in terms of the indications and findings of this research, Youth’12 research. So yeah, basically here, general health. I guess it says there, not I guess, but it says here in 2012, most students, 91%, reported that general health was excellent, very good, or just good. Despite this, 20% of youth reported a chronic health condition and 9% reported a chronic disability. So again, we have Thea here, sorry I forgot to say, joining us. Generally it says that like students are 91% anyways, majority of them are quite healthy, or they feel healthy, or their health is generally pretty good. Back in 2012, I guess being in youth, being in that stage, adolescence, it's a stage of life where it's quite associated with good health, in my opinion, because it's a stage where you're kind of active still. Don't you? Would you agree or not? Like, this is when you're still very quite active before you hit that stage where you, the peak of your I guess metabolism and your all that kind of stuff. So that's good to know that 2012 back then, students or youths were pretty good in terms of their health. But it will be quite interesting if any of the, I guess, advances in technology and problems that have arisen since 2012 kind of will affect that now, or like will affect the numbers much now. So access to healthcare. Says here 79% of young people had received healthcare in the last 12 months. So 79. It's a good number. So that indicates that when majority of youths or students, what you can take from this is that either they or their families have good, are good in terms of following up with their students. 79% of 2012 population student, anyways, have seen a doctor, and that's but that's still what? Sorry, I'm not very good with maths. 21% have not really, who knows what that 21% could be have been going through. They could have been sick but not seen a doctor. So, and that's due to multiple reasons. Maybe they just didn't have enough money to see a doctor, or maybe no time, maybe. So yeah. So what do you think are other indications of why people can't, or students don't have access to healthcare? Because it's meant to be free, right? Yeah, for youths. But
at this point I don't really have an idea as to why, because like what you said, it was free up till a certain age. I'm not too sure.
Yeah. What isn't free though, actually it is up to a certain age also, like dental care. Certain isn't it just certain parts of things? So it says here, over the age of 17, dental care is free. So I mean not under 17
Yeah.
is free. Says that almost all students, 94%, had seen a dentist in the last 2 years, and that's probably due to um, dental care or like checkups being free, right? So that's good.
Yeah, so they have, I know that there have been dental vans, dental visits
Yeah,
for secondary schools, so that could be a way. And through that, I guess treatment can be done, whereas, fillings and things like that. And then I guess further dental care can be
yeah,
recommended from there with clinics and things
yeah.
like that.
True. Says here, healthcare services accessed in the last 12 months. So this is going from 2012. So the family doctor is the most popular one, as majority of that, as you can see, that massive blue thing. Next is the pharmacy or chemist shop. Obviously, a lot of people tend to kind of self-diagnose and just buy their own things, and sometimes they don't even know. But that's a very also youth thinking. Sometimes youths of these days think they're invincible and kind of tackle everything. School and health clinics, a bit disappointing here. I feel like that could be more because in schools it is free, right?
Yeah.
If your school has a clinic, it should be free.
Mm.
So I reckon students need to kind of be aware of that and just utilize that more. Hospitals, A&E accidents and emergencies, after hours, A&E's, sexual health, alternative health workers, and youth center. So there's a massive kind of rise into family doctors, but family doctors are definitely what's popular, and obviously it's the most accessible one, it seems, almost, especially if you're a youth and not quite confident going by yourself. And yeah,
Yeah.
but yeah, that's it for this one. Thank you.